Hello, so you're shadowing in the OR. Welcome. I am one of many perioperative nurses here in St. Boniface Hospital, and I will help guide you through what to expect on your first shadow day here. Please arrive 30 minutes prior to your shift. This will allow you enough time to locate the scrub and locker room while giving you enough time to change. When you step into the hospital, you'll be wondering where to go. The OR is located on the second floor in the L block. The best way to reach the scrub room is to go up the stairs that are located across the main elevators. Once on the second floor, you'll walk by the family room to your right and continue through a set of double doors. Continue down the hall until you reach big windows overlooking the nuns' garden. Go through the double doors, which open automatically. Beside the elevators to your left, you'll see the scrub room. After leaving the scrub room, turn left and continue down the hall. Here you'll find your respective locker room. Breaks are included. The nurses will let you know when it is a good time as to not miss an important part of the surgery. Let the nurse know when you're going, your estimated return, and when you're leaving for the day. You're welcome to use the OR lounge. There is a fridge for your lunch, microwaves, and a toaster oven. The phone in the lounge is available for personal, local calls only. And please eat breakfast. Your shift will end at 15:45 or whenever your CEF tells you. To help make this a successful OR shadow day, we recommend you bring the following items. A name tag, photo ID, and clean hospital shoes are mandatory. The rest are nice to have. We really recommend compression socks as you may be standing for a long time, and definitely lunch because no one likes a hangry episode. Then, proceed to the scrub room and grab an appropriate set of scrubs. We'll discuss OR etiquette in the next slide. Go to the locker room and change. Make sure your scrub top is nicely tucked and hair is not visible. Then make your way to the front desk. Please ensure you sign your name with your designation and clinical placement. Here is a map to help you visualize the OR unit. If you have any questions or are lost, please don't hesitate to ask any of the staff in the corridors. Once you have received your assignment at the front desk, you're ready to start your OR adventure. But wait. This red line will remind you that you need to don appropriate headwear and have a mask available. And remember, only enter the OR theater using the scrub room doors and never the double doors, as this protects the patient's privacy and maintains dignity. This is a special environment. Here are some tips on OR etiquette. Make sure your ID is visible at all times and that your OR scrub cap and mask are on as mentioned in the previous slide. Please refrain from bringing any personal belongings into the OR theaters as we try to keep the OR aseptic. Most importantly, as healthcare providers, we always abide by FIA standards. Please maintain asepsis and be vigilant and controlled in your actions. Be aware of your surroundings at all times. The surgical team will answer questions and explain events at appropriate times. Sometimes quiet is required in the room. For examples during induction, while inserting invasive lines, clamping, or stapling. These are the following items you'll observe in the pre-op area. The first circulator is responsible for checking the patient in preoperatively. Now we have brought the patient into the OR theater and we're ready to do a briefing. Each column outlines what we discuss in a briefing before the patient goes off to sleep. This is done to ensure we are all on the same page. A timeout is right before we cut skin, and a debriefing is when the final count is complete, or before the surgeon leaves the OR. There are 3 roles within the OR that a nurse may do. A nurse is required to know all 3 roles and perform each role throughout the day as staffing, skill, and scheduling allows. When working, the circulating roles often overlap as we help each other be as efficient as possible. The first circulator role involves guiding the patient undergoing surgery from the very beginning to the very end. They are responsible for interviewing the patient, checking their understanding, readiness, and preparation for the procedure. The first circulator is the nurse that is able to provide the most comfort to the patient during a very stressful event in their lives. This is where we use our bedside therapeutic communication skills to provide reassurance, answer questions, and maintain patient dignity. The first circulator collaborates with the anesthesia team and the surgeon to decide on blood products, antibiotics, and VTE prophylaxis. We also discuss the need for a Foley catheter, which is an excellent opportunity for you as a nursing student to try and insert the Foley, so brush up on your skills. We also go over positioning for the specific case. Once the case is underway, the first circulator will chart pertinent information and collect specimens. At the end of the case, the first circulator will complete the charting and aid in emergence of the patient from the anesthetic. Once the patient is awake, the nurse will accompany the patient to PAR, or post anesthesia recovery room, and will provide a report to the receiving nurse. The second circulator ensures that the theater is set up with the correct equipment and instrumentation for the surgery. This includes bed, monitors, cautery, lasers, scopes, and such. The second circulator will set up the scrub nurse in an orderly fashion, reading the doctor's preference card while checking sterility indicators and equipment functionality. The second circulator counts the scrub nurse in and out. Throughout the surgery, the second circulator will keep an eye on the scrub nurse, ensuring they have everything they need for a successful scrub. Ideally, the circulator will anticipate the scrub's needs without them having to ask for it. The scrub nurse gets to have the most fun. He or she performs hand hygiene and then a sterile scrub, which is pretty much what you see in the movies with the sponges. Once gowned and gloved, they set up a sterile field while checking the instruments for defects. Once they have everything they need, the scrub nurse will count with the second circulator. The scrub nurse will help drape the sterile field and gown and glove the surgeons and residents. During the surgery, the scrub nurse is focused on the surgeon and their every move. The scrub nurse is anticipating what they will need, therefore, knowledge of the sequence of events of each surgery is imperative. The scrub nurse and the second circulator have finished setting up the table. The next step is to count all the instruments on the field. We count everything because we want to ensure no item is left behind. That includes sponges, sutures, blades, forceps, etc. All of our sponges are radiopaque, meaning that if they're left behind, an x-ray will detect them postoperatively. Imagine there's an emergency case. Things are happening very fast and you need to control the bleeding. Instruments are moving about and it is quite easy to lose track of them all. That is exactly why we rely on the count to ensure no items are retained when the incision is closed. Therefore, we count the instruments before the surgery to know what we start with, when we close any body cavity, such as the peritoneum, and when we close skin. The surgeon is always notified of the count status. Every surgery requires the patient to be positioned in a specific way. Our goal is to have the patient positioned in a way that allows the surgeon to access the operative site while minimizing the pressure injury risk. You will notice on your shadow day that positioning may take the most time. We use a variety of positioning aids, such as gels, foams, attachments, bed extensions, and straps. Throughout the case, the nurses are responsible for hourly limb checks. The positioning is charted as well. As a non-sterile person, it is important that you do not reach over the sterile field and that you keep a 1-foot distance away from the sterile field at all times. Do not walk in between two sterile fields. Try and stay engaged in what is happening during the surgery, but also be mindful not to stand too close to whatever is blue, green, or purple. As you can see in this picture, it shows the sterile areas of a gowned person and the appropriate stance when scrubbed. We mostly use two types of prep. First is a ChloraPrep stick, which you see on the left. We use this preparation solution to disinfect and sterilize the operative site. It is only used on intact skin and avoid using it on mucous membranes and open wounds. The other type of prep most commonly used is povidone. This is not flammable and is okay to use on mucous membranes. We use this prep for open wounds, the perineal area, and the face. Here is our awesome team in action. There are a few other team members whose roles we have not discussed yet. It takes a village to conduct one surgery, and every role is equally important. In this picture, you can see our scrub nurse by her table, our two circulator nurses, a surgeon, a resident surgeon, and a high-risk anesthesia nurse with an anesthesiologist behind the drapes. However, none of this would be possible without our orderlies and operating room assistants, and the induction team, who is responsible for replenishing our anesthetic supplies, and our MDR, which stands for Medical Device Reprocessing Team, who works hard to organize, sterilize, and package our instrumentation for each and every case. And this is just a condensed list of all the effort that goes into ensuring we have the resources to perform surgery safely. The anesthesiologist assesses the patient preoperatively to make sure they're stable for surgery. They ensure the patient is comfortable intra-op and post-op. Not only do they manage their pain, but they also monitor their hemodynamic status. They do so by continuously monitoring the patient's vital signs, lab values, and administering blood products. St. Boniface has a variety of different surgical services, for example, urology, gynecology, general surgery, ear, nose, throat, head and neck, plastics, vascular, cardiac, ACSS, which is acute care surgical services, and we also do electroconvulsive therapy. In total, we have 14 operating theaters and we do over 10,000 cases a year. Please make sure you eat a well-balanced breakfast before your OR adventure. It's normal to feel a little bit off or uneasy when seeing a surgery for your first time. To prevent chances of fainting, tell your buddy nurse you're not feeling well and move away from the sterile field. Sit down as soon as possible with your head between your legs and take off your mask and take some deep breaths. We'll call for someone to escort you into the lounge and get you some water. Now that your OR adventure has come to an end, please ensure that you dispose of your OR scrubs in the laundry basket located in the locker rooms. And don't forget to return your access key. Thank you so much for your time. We are excited to show you around and answer any of your questions. Please don't be shy. We love to talk about why we are so passionate about working here. We want you to be as excited as we are. If you have any questions, please email Carrie McCory, our educator, at the email provided.